Some big news coming in on AAP government informing the Delhi High Court that it is actively considering steps including imposing night curfew to tackle the COVID surge. No decision taken as yet, but is considering. The government is what the government there saying that it is considering taking some measures including a night curfew, but no decision on that as yet. This comes after the Delhi government says that ICU beds will be added within 6 to 8 days. Delhi High Court observes, and I quote here, Delhi government's compliance of our last order on procuring more ICU facilities is inadequate. This is what the Delhi government says while wrapping the Delhi High Court says while wrapping the Delhi government on the COVID preparedness. Anessha joining us live for more details. Anessha, the Delhi High Court there coming down heavy on the Delhi government for their COVID preparedness. Here, the Delhi High Court asking what has the Delhi government done with regards to procuring ICU beds as well. Their actual action taken on ground is inadequate, is what they say. Take us through the further details pointed out by the Delhi High Court and Delhi government's response.
Well, Nabila, the High Court is still hearing the matter. The hearing is still on in the Delhi High Court, and various aspects of the COVID preparedness are being taken into account. What is very, very important is that the court had pointed out that various states have now once again started night curfews or weekend curfews and closed down certain markets. And they asked the Delhi government, what exactly are you doing about it? Are you also planning on reinstituting the curfews? The government has said that we are looking into it. We are talking to market associations. We're talking to RWAs, and even on that, the Delhi government has been questioned on what exactly are they doing to raise more awareness among the RWAs, among the market associations. What are they doing to ensure that there is no overcrowding and hundreds of people don't congregate in places? Whether they have done anything to ensure that the fines that are now collected for violation of COVID norms, how exactly is that money being used? What is it that money being used for? One suggestion that has come from the bench is that an online portal could be created for payment of these fines, so that the data about the fines and what is being done about it is also very clearly available. When it comes to hospitalization and ICU beds, etc., the government has told the court now that the mortality rate right now is about 1.9%, and they have enough beds in ICUs. They also claim that they will be increasing the ICU facilities. The High Court, of course, is not happy with the speed at which this is being done, because they were informed more than 2 weeks ago that more hospital beds and more ICU beds will be created. So they've said that they're not happy with it. It is not adequate according to the data you had given us the last time. When it comes to crematorium, the High Court has been informed that there are about 380 slots that have been reserved specifically for COVID patients, and less than half of those are actually being used. And the Delhi government has said that they hope that the crematoriums will not need to fill up all their slots. So the hearing is still going on. We will keep updating as and when.
Thank you very much. Anessha here, the Delhi government there being wrapped by the Delhi High Court says they're doing all that they can, everything possible to ensure a curb in the infection rate across the national capital now.